Hi, everyone, and welcome back to our IVF webinar with Dr. Liana Dorofeeva. You can see her right here. And if you've been here on Tuesday, you know that this is a second webinar with Dr. Liana this week, and I'm very, very happy that you are back. It's always great to have you, Dr. Liana. And how are you feeling tonight? Hope you are having a good day so far.
Wonderful. Thank you, Carolina. And as always, this is my pleasure to be here with you. And today, this is a special topic. We spoke about a lot of things which are related to the medical treatment and different strategies. And now we are going to talk about legislation, which is also important.
Definitely. So we are glad that you have prepared this presentation on our topic. And of course, we will talk about regulations when it comes to IVF, but also egg donation and other treatments in Ukraine. So as always, we will start with Dr. Liana's presentation. She will explain everything, all the details that you should know. But of course, afterwards, if there are some other things that you would like to ask, you will be able to do it during our Q&A session. All you need to do is just type those in the chat section, and Dr. Liana will definitely answer them for you. And if you don't know Dr. Liana yet, okay, she's been here many times before, but if you don't know her yet, let me just mention that Dr. Uliana is the Director of International Cooperations at IVMed, which is located in Kiev in Ukraine, but she's also Medical Director at Ovogene, Egg Donor Bank, and of course she will tell you about how it all works tonight as well. And yeah, I guess let's get going with our topic tonight. I'm your host, Caroline, as always, and I guess we can start off with our presentation, okay?
Absolutely. Perfect. Let's get started.
Let's go ahead.
So good afternoon and good evening, dear attendants. And this is my pleasure, as always, as I said, to be here with you. And, talking about legislation in IVF, this is so important topic because there are many, many millions of people around the world who are experiencing infertility. And part of them would start from their treatment using their own oocytes and their own sperm. And these are treatment strategies which are widely available in the world, still with some regulations. And these regulations are changing. Probably some of you have heard about the historical moment of changes in France. Just recently, a few days ago, when it started to be allowed to treat not only married official couples, but also single men and women and unofficial couples. So legislation is changing. Opportunities are here. But before the COVID and starting back again right now, many of patients from different destinations all over the globe need to experience and need to learn about different countries and different regulations because of the limitations in their home countries, especially limitations for these kind of treatments, which are, let's say, some kind which are egg donation and surrogacy. So you cannot find an alternative. So if you are not producing your own oocytes and you need, for the medical reason, you need egg donation treatment and there is no allowance in your country, so you should look in for the opportunities somewhere else or some other alternatives. The same about surrogacy for medical indications. So we need to talk about this. As well, medical tourism for IVF. This is to reduce the costs for cross-border medical treatment, to look for the same high-quality care and services in different destinations. And sometimes if this is also combined with attractive destinations, so this will be also good. I'm proud that Ukraine is one of those countries which has been receiving many patients from all over the globe. And I remember this like last year's 2018-19, before the COVID started, when we received over 500 patients from more than 30 countries during a year for different kinds of IVF treatments, especially for egg donation, surrogacy, and some special alternative, which we call experimental treatments. We will talk about those. I'm practicing in IVF since 2008, and mostly I'm working for international market between our clinics, our partners, and also for international patients. And I know that we were on the map together with such countries as Spain, as Czech Republic, as North Cyprus, Greece, Russia, Poland, and some other locations recently. But this is the graphs which you might see right now, this is very recent graph from Egg Donation Friends website since November 2020 until the end of the first quarter 2021. So this is already a post-COVID data showing us the number of the registrations of the patients who are looking for the treatment in the different destinations in different countries. And I'm really happy to see that Ukraine is number two, sorry, but I would like probably to say number one. Number two, in terms of the country where patients would like to get their treatment. And many of clinicians, many of clinics with their good names, they were working really hard in order to see the pictures as is. Also, in regards to the number, why we need to talk about Ukraine. So I would like to share with you some information regarding our country, if you still don't know so far. So Ukraine is located in a territory of Europe, very close by. So we have several borders directly with the European countries. And this is a huge country of over 600,000 square meters, and total number of population is over 40 million people. All IVF treatment in Ukraine is private. Right now, we have over 60 IVF clinics working with their medical licenses, and we have more than we don't know how many because their activities are not regulated agencies who are also offering intermediate services for medical treatment in terms of the IVF. We will talk more about the legality, but I just would say that the oocyte donation and surrogacy, as well as the export and import of biological materials, are permitted in Ukraine. And probably oocyte donation was one of the most common treatments, as Ukrainian women, they are really with their extreme beauty, with their we know how to treat them for oocyte donation. We know how to select a good donor. We know how to manage these kind of treatments here in Ukraine. So just to say more specifically about the legal regulations of IVF in Ukraine. So it is regulated by the Family Code of Ukraine and the instruction of the procedures for the use of the assisted reproductive technologies approved by the order of Ministry of Health. And this law was not changed since 2013. So regulations are quite strict, and they were not changed, and they are not going to be changed. So we are working to have a reproductive law. However, it should be based on the order which we are going to talk about during this webinar. So what it is said in the order of Ministry of Health, that there should be the medical indications for use of the IVF treatment. IVF treatment can be performed for married couple or for a single woman. Gamete and embryo donation as well as surrogacy are allowed, and surrogacy may be performed only for married couple where women should have medical indications for surrogacy. And the article of the Family Code of Ukraine determine the origin of the child born as a result of the use of assisted reproductive technologies. And it says that if the wife gives birth to the child conceived as a result of the use of assisted reproductive technologies carried out with the written consent of her husband, he is recorded as the child's father. In case of transfer to the body of the other woman, an embryo conceived by married couple as a result of assisted reproductive technologies, the parents of the child are the married couple. And in case if a child born is by the wife after human embryo, which was conceived by the husband and another woman who is a donor as a result of using of assisted reproductive technologies and transferred to her body, the married couple is recognized as a parents of this baby. It is important to mention that the age limit for IVF treatment in Ukraine is not clearly determined. So, adults who have medical indications, both male and female, for the use for the IRT technologies, they can be treated by the IVF techniques. And the decision and procedure is established by each clinic independently, taking into account ethical and moral norms. Most commonly, this is you will hear from the clinics probably 51, 54, 56 years. However, we would definitely consider the somatic status and the health status of the patient. Genetic testing of the embryos is performed to reduce the risk of the hereditary diseases and to increase the frequency of the pregnancy. And indications, these are the possibilities or the risks of giving birth to the child with mutations of any isolated gene or with chromosomal abnormalities, which have been detected as a result of medical and genetic examination. And PGS, PGD may be performed as the patient's own discretion in the presence of the application for the pre-implantation genetic testing, which is the form from the annex from the order of the Ministry of Health. Such kind of experimental treatment, they are not specifically regulated by the law. However, which kind of experimental treatment we usually perform in Ukraine, I mean ovarian rejuvenation as an example, mitochondrial donation, pronuclear transfer, IVIG treatment. They are performed in accordance to the medical evidence which we already have and practical experience of the physicians and the experts in the clinics, but after signed consent and considering all medical risks for the patient. Article 48 from the law of Ukraine says that the use of the artificial insemination and implantation of the embryos is carried out in accordance with the conditions and procedure established in the Ministry of Health of Ukraine on the basis of the medical evidence for the adult woman with which such an action is carried out, subject of the written consent of the spouse, the provision of the donor anonymity, and the preservation of medical secrecy. Disclosure of the donor's anonymity may be carried out in the manner prescribed by law. And in accordance to the order of Ministry of Health, there are different types of donations which are allowed. This is oocyte donation, sperm donation, and the embryo donation. Who are our oocyte donors? So the oocyte donor candidate, this should be a woman who may be a close relative or anonymous voluntary donor. Also, patients of the IVF programs who, upon their written consent, give the recipient part of their oocytes. However, egg sharing, so-called egg sharing for oocyte donation, is not as common as it is in some other countries, and the privilege of the oocyte donation, these are anonymous or non-anonymous, considered by law female donors, who are donating for the needs of the infertile patients. And the requirements by law for oocyte donors are the age of the woman between 18 to 36 years old. She already should be a mother, so we are one of those several countries in the world who request donors to have a proven fertility. There should be absence of negative associated traits, satisfactory somatic and psychological health, absence of hereditary diseases, and bad habits. Indications for IVF treatment with oocyte donation are the absence of oocyte production, risks of passing the genetic disease, and unsuccessful repeated attempts of IVF with the low quality of embryos and repeated failed implantations. Requirements for the sperm donors are the men between 20 to 40 years old, the presence of the healthy baby, as well as for the oocyte donors, absence of the negative traits, the somatic and hereditary diseases, and bad habits as well. I should mention that in addition to the regulations by law, clinics also may decide regarding the specific signs, or, for example, in our practice, we do not allow donors to be over 30 years old, just because of the presence already of the aneuploidy of the oocytes, and also we control the quality of our biological materials donated by donors, and also some other criteria could be additionally dedicated by the clinics. Embryo donation. So embryo donors may be also patients of IVF programs, which after birth have remained their cryopreserved embryos stored in the clinics. So to donate those embryos, they should sign the consent. Uh, Donated embryos could be embryos created from donor oocytes and the donor sperm. And under voluntary informed written consent of donors or patients, these embryos may be used for the treatment of infertile couples who are recipients, as well as the female recipients or single women. Embryo storage is not limited by law as it is in some countries. So we know in the world there are countries with limitation for 5 or 10 years of the storage of the biological materials for the patients. So in Ukraine, you might store your materials as long as you wish. There should be just a signed statement due to which there is an agreement for the storage of the embryos in this specific medical institution for the certain period of time, but this period may be prolonged. And clinic may destroy patients' embryos only after receiving the voluntary consent originally signed by the patients. But Ukrainian law doesn't have any procedure which regulates this issue if there is no signed document from both sides. And many of our clinics, they are storing a lot of embryos if patients, especially patients from abroad, are not communicating with our clinics. So you may be sure that until if you haven't provided the written consent with 2 original signatures, your clinic should not destroy your embryos. The transportation of biological materials across the Ukrainian border, it is happening. However, still there is no specific law which will regulate this transportation. And I'm also a co-founder of the Association for the Medical Transportation, because there are some discrepancies and some questions which needs to be answered. However, what we are recommending for our patients, because a lot of the transportation of biological materials is happening from Ukraine to different destinations, as well as from different destinations to Ukraine. So patients should provide a statement and an act of transferring of cryopreserved embryos, and there is a draft of this act which will be provided by the clinic to you. There should be a letter also from the clinic that she is ready to send these biological materials, and another clinic which is going to receive these biological materials. Also for the transportation through the customs, there should be a special code received for these biological materials. So it's better to use special companies who have experience in this, and better, so it's preferably to be performed as the hand carry, because there is no specific procedure, and to avoid keeping these materials for the long time in the customs. And we know that the special containers where we perform the transportation with help of which they have a certain time once they keep the special conditions and safe conditions for the embryos. So this should be well controlled by the dedicated people. However, it's happening quite often. And if this is happening by the company, of course, they are avoiding X-ray. Absolutely. So clinic is providing the letter, the statement that this material should not be X-rayed. And I've been involved in many of those transportation, and I may say for sure that our big airports, which are formally they know the procedure, so they definitely they don't perform the X-ray for the biological materials. So different IVF techniques and the procedures are allowed to and perform successfully in Ukraine, such as, of course, IVF, ICSI, IUIs, assisted hatching, frozen embryo transfer, oocyte donations, both fresh and vitrified, embryo donation, embryo adoption, social freezing and preservation, PGS, PGD, experimental treatments, which I mentioned. So we spoke already a lot during these webinars about these techniques, and ovarian tissue cryopreservation for the further needs. So why choose Ukraine as your destination for the IVF treatment? Of course, because of the legality of such procedures, which are in many countries very limited or not allowed, as oocyte donation and surrogacy. I may say that Ukraine has still the best pricing policy, and most procedures in Ukraine are much less expensive than in some comparable countries with the same quality of care, the same quality of treatment. And the quality of treatment and quality of care in Ukraine is extremely high. You need to be specific in terms of selecting the clinic, because you remember I said that we have already over 60 clinics practicing in Ukraine. I've been working since I started my practical experience in the clinic, which was second on the territory of Ukraine. And we are joking that even our IVF specialists are all quite young. But your professional experience and expertise, it's not according to your age, however, according to the number of the treatment cycles you performed. There is no visa required for many countries, for most of the countries of the world. And even right now, during the COVID situation, there is no quarantine. This is also important to mention. And patients may come, and they actually could came here even during all the time of the quarantine for the medical treatment reasons. We have excellent success rates, and you need just to ask your clinic and your physician to provide this data. And all good clinics, they have this data, very specific, very dedicated to the specific reason of infertility, to the age of the patient. So they are very open to share this. There is no waiting list for oocyte donation and also for surrogacy. These clinics which are busy and which take care about their patients, they have enough oocyte donors, or they are using egg banks, and they have usually enough surrogates to start treatments immediately. And our donors are with extraordinary beauty and the proven fertility for sure. Also, we follow the screenings according to the regulations, not only in Ukraine, but also for international regulations, including extended genetic testing, including psychological deep evaluation for the donors, including all infectious disease with the PCR testing, which gives more certainty about the window where during which the infection could be detected. And also for the donors, we in our center, in our bank, we check the quality and the previous results. So we may share this data, and we predict the result from this donation, and we use only very successful donors with great results. So my recommendation, in order to select a clinic in Ukraine within the huge list, would be the years of experience in the field of the reproductive medicine, high and open data regarding their success rates, the presence of international certificates, and this is very easy to get right now. So some clinics out of this big list, they are ISO certified, and if they are ISO certified, you can also ask for the internal procedures, instructions, SOPs for the specific procedure and how it is going to happen. Also, it is important the availability of the experienced doctors and the embryologists and the team of medical coordinators. And specifically for international patients, it is important and and for all patients, but extremely for international. So you need to have a person who will be 24/7 in touch with you, answering all questions, providing very detailed information regarding everything, starting from the accommodation and cost and the success rate, and how long should you stay in Ukraine, and what will be happening during each stage of your treatment. Cutting-edge embryology laboratory is crucial because doctor can do a lot. We can evaluate your previous history. Very often our patients, they are coming here for the second opinion. These are many of the patients with repetitive negative outcomes before, and we are doing a lot in terms of the evaluation of the medical history, of looking for the specific reason, what could be the reason for this infertility. However, without a successful and well-experienced team of the embryologists, this would be just a half of the success. So we may say that our embryologists in our team are really the best, and also equipment and the conditions in the lab. They just needs to be in accordance to the international requirements. And again, it is easy to follow. The ability of the undergo all the necessary medical examination in the same clinic. This is also says that clinic knows what needs to be done additionally, and this is a comfort for the patient to do this all in one location with the same team. Patient references, of course. So we are communicating very openly now, and every patient who have experienced the treatment in that clinic will be happy to share his experience. And the pricing policy, of course, it is important. There should be clear agreements. There should be clear guarantees. In good clinics, not even one lawyer is working. However, a team of legal team, which is also involved to explain all the details in terms of specifically surrogacy, which always comes with many of the questions, as it is really time consuming and not easy procedure in terms of the regulative aspects as well. Also, due to the COVID and even before that, part of our activities and our responsibilities was to provide export of biological materials out of Ukraine, and helping by these different clinics and patients of those clinics all over the globe to stay at home country with the best comfort and avoid traveling, and get biological materials in their home country if this is possible and regulated by their law. So we are sending a lot of oocytes and embryos created in Ukraine into different destinations. You just need to share with us where you are located, and this will be possible also. Avoid traveling to Ukraine, however, get some of the treatment done in your home country under the agreements between the clinics. So thank you so much, and I will be happy to answer your question gladly. So if we haven't touched maybe something, so please ask here and I will answer.
And excellent, as always. Thank you so much for this presentation, for explaining all those details. Definitely useful, as always, Dr. Liana. And as you can see, we have plenty of questions. So I guess it is time for our Q&A session. So let's get to those, okay? Perfect. Okay. The first question is, which test you perform to confirm that bad habits like drugs are excluded? Can we have access to this test when we choose a donor?
Yes, of course. So again, this is, as I mentioned, these are not just the requirements of the law in Ukraine, because there is a list of the tests which needs to be performed for the donors. However, we do a lot more. And this is according to our practical experience and just to to confirm that we are doing everything according to the good clinical practice recommendations and international recommendations. So there is a list of tests, which are 5 drugs and nicotine and alcohol, which are performed before every stimulation, during the stimulation for every donor. And the results, by request of the patients, may be included in the list of other tests which are usually provided for the donors, such as karyotyping and infection panel, consultations of the doctors, etc.
And thank you so much indeed for the very first question, and of course for your answer with that. And can you tell us if ROPA method is available in Ukraine?
By law, we might treat individual patients who are single women who have medical indications for IVF. So quite often we know, and also there is a donor, there could be a known donor for the patient. So this is how this method could work. However, by law, we need to be sure that we are following the regulations, that there is a woman who has a medical indications for oocyte donation, let's say, or surrogacy, and there could be another woman who is known donor. So she could be a known donor in Ukraine, and she might produce her biological materials to be used by another patient. So this is how this method can work. But I would say in my practical experience, we don't have a lot of those patients asking for this. But probably now there will be a possibility to get more.
Okay, understood, of course. Thank you. That's there is a way, just a little bit differently. Yeah, done.
Mm-hmm.
Thank you. Definitely. And let's have a look. Next question is X-ray scientifically proven to be damaging the embryos or sperm?
There are many still information which we may not be sure about. Specifically, X-ray is also in this, I would say, list of those questions. However, it was my personal interest to make sure what is the dosage of the different kind of radiations during the transportation of biological materials. And this is published data regarding which the medical courier who was performing a hand carry transportation was measuring the level of the X-ray during it was a mock transportation, so no materials inside, but just an empty container, which was going through the X-ray, and then during the flight for different destination. For the short destination, meaning it was a different level where the airplane was flying under the earth. So short destination and the long destination flights. So I should say that for the long destination flight, the level of the irradiation, and they had a special equipment to measure the level of the irradiation, was almost the same as during the X-ray check in the airport, and it was much longer. However, also in my experience, we had some transportation after which long transportations, after which we did the NGS testing of the embryos created from the oocytes, which were during this transportation. And these were companies, not our company, which we are considering now to do a hand carry, but it was a cargo transportation. So we were not sure that during this cargo transportation, X-ray was avoided. So the level of the mutations coming from those donor oocytes was extremely high. It was over 50%, where we considered that this could be an issue related to the X-ray. However, of course, there is no much evidence about this, and different clinics could have different opinions. However, our opinion is to avoid X-ray during any transportation and perform hand carry transportation with the presence of the person who will take care of this transportation during all way, if this is possible.
All right. Again, thank you so much. Definitely interesting question. Thank you for thoroughly explaining that. Okay, and let's have a look. Next question is about gender selection. Is it possible in Ukraine?
Yes, in Ukraine, we perform gender selection for the, as it was mentioned by law. So there should be a statement by the patient that she is requesting the gender selection. For medical indications, it is performed in order to avoid the sex-transmitted diseases and mutations, and also the family balance.
All right, wonderful. Thank you so much for the clarification and also for the question. And let's have a look. Next question again, interesting one. Can Canadians use surrogacy services in Ukraine? If yes, will surrogate fly to Canada to do the transfer, or embryo has to be shipped to Ukraine? Okay.
Thanks, Mariam. Yes, Canadians are performing IVF treatments in Ukraine. I would say quite many of them, even though in Canada also surrogacy is allowed and performed. So, but I believe there is a price difference. The reason why Canadians are coming here, as well as the patients from the US. And there is no need to fly surrogate to Canada because it's much easier in terms of the logistics and risks, and also right now the issues with the visas and passports. So, for example, to get surrogate who will be easily entering Canada, it's not that easy. And to request for Canadian or US visa right now, they are issuing only essential visas. So it's easier to bring embryos and to perform embryo transfer here for the surrogate and to follow all these procedures. Definitely you would need to contact the clinic. You would need to get information about how all this happening. And clinics, they are sharing usually a lot of information about every step of the treatment for the surrogate, ultrasound, embryo transfer. There are coordinators who are taking care about surrogates, and communicate with the patients. So best way would be to fly embryos to Ukraine in this situation.
Again, excellent. Thank you so much. Definitely good question, great question. And actually, there is a follow-up, which is also very, very important for anyone who is considering surrogacy. How the birth certificate is issued. Can parents bring the baby to Canada in terms of Canadian law?
So in Ukraine, because surrogacy is allowed, so we perform surrogacy for patients from different destinations. For those countries where surrogacy is also permitted, it is much easier. But for each process and before starting the surrogacy treatment, we always recommend each couple, depending on which nationality they are and specifically father is, to consult with the lawyer to get all the clear information regarding the process and what needs to be done prior. For some countries, there are some activities and actions which needs to be done prior to starting the IVF treatment. And then after they have a clear understanding of the process, we are starting the medical process, I would say. So also reading the agreements, signing all the agreements, understanding if there is a need on the DNA testing for the baby further after delivery, etc. So many questions needs to be solved in advance. But for Canadian patients, because they are written as a mother and father, as I stated during the presentation. So the married couple who used surrogacy, they are in the birth certificate, they are already written as the mother and father. So together with all additional documents, which will be in details providing this information by the lawyer, it is very easy to get to Canada together with the baby. The process is a little bit different for the countries where surrogacy is not permitted. And then there are some other like recommendations how this needs to be done in order. Patients need to be here during the baby delivery. They need to communicate with the consulate before the program is started to get additional permissions. So this is all is communicated by the lawyer, and this is a lot of situations, and better to discuss this. And of course, it is discussed prior to the program.
Okay, excellent. Thank you so much. Definitely interesting question in regards to surrogacy. And while we are on this topic, surrogacy topic, I will show you the next question. We will go back to the previous one, okay? So for single men, can you do egg donation and surrogacy whose name appears in the birth certificate?
For single men, we cannot do surrogacy. We can do egg donation also just for a single woman. So for single men, absolutely no treatment allowed in Ukraine.
Okay, thank you so much for the clarification. And as you can see, there's a thank you from the previous patient in regards to your previous question. And now there is a question from your, I guess, former patient as well, or right now the patient has asked, I had egg donation treatment in Ukraine and Auvergne lab transferred me the wrong embryo egg donation embryos, I guess. The lab transferred something else other than was stated in the system that they took note in their piece of paper. Could you help me to deal with this situation, fix it somehow?
So dear C, I would say that if this is a situation which happened, I need more details from you, even maybe right now, because in Auvergne lab, firstly, it works for 1 year, and I may say that we are having all information regarding all the patients for whom treatment have been performed, and I'm not aware about the situation happening with the changing the embryos or any situations like you are discussing right now. And how we avoid situations to happening like this. In our laboratory and in the clinic, we have an electronic witnessing system. Once you're entering the clinic, you're getting the bracelet, probably you know that identifies you as the patient. And all the materials which are dedicated to you as a patient, they also have the same chips. And the information, if we are changing the materials, we are getting the alarm immediately. In addition, that embryologists are performing the double check procedures in the lab. So if this is something really recent, and in case we have any non-conformance and any situation which is out of the algorithms, we have a quality management system, and quality management is aware, as well as myself as the medical director. So if you, yes, I see that you got the bracelet. So I will be happy to communicate with you directly, even immediately after this webinar, to find out more information about the case.
Of course, that's perfectly understandable. And remember, you can get in touch with Dr. Diana. I always am able to share, of course, Dr. Diana's email address, so you can get in touch with her just to get more details and sort this out. I'm sure Dr. Diana will be able to help you out with that as well. Okay, I will put it in a second, Dr. Diana, okay?
Yeah, absolutely. Thank you, Caroline.
Perfect. Thank you so much. And of course, as you can see, there's the thanks from our patient right here. And Dr. Liana from our previous patient that asked the question. There's a thanks so much. Okay. Okay, let's have a look at the next question. For single women, can you do double donation, both egg and sperm donation? If so, what is registered on birth certificate?
So, Sinat, yes, for single women, we can do double donation. However, the lady who is a mother is carrying the pregnancy. So if she carries the pregnancy and she delivers the baby, she is written in the birth certificate. However, we cannot do double donation and surrogacy. So at least one of the parents should be genetically dedicated to the baby. So we cannot do surrogacy for single woman, and we cannot do surrogacy with the material which is absolutely donor, like the donor egg and donor sperm. But for single woman, double donation and transferring embryos to her uterus, we may do.
Excellent. Thank you so much indeed for yet another question and explaining this to us as well. Okay, next question is up, and it is about guarantee packages, live birth guarantee packages.
Yes, we are offering live birth guarantee packages. There are special indications for the sperm quality, and we will be happy to share with you this specifically. This is sperm morphology, DNA test, karyotyping, being normal, etc. And live birth guarantee we can do also for transferring embryos and for a certain number of blastocysts, and also live birth for the surrogacy.
Excellent to hear that as well. And one more question from Angela. Do you have time-lapse videos monitoring the embryos?
Yes, we do.
Okay, excellent. Thank you so much for the clarification, of course. Okay, one more from Angela. And it might be our final question. However, if you have any more, you know what to do. Just type those in right now. This will be like a final call for those questions. And the question is, how long does the NGS 24 take to get the results of which embryos are euploid?
We are working with the certified laboratory. We are not doing NGS 24 in our laboratory. We are just doing the biopsy. However, the logistics is very easy and fast going. So we are getting results within 10 to 14 days.
Okay, perfect. Thank you for the clarification. Next question is a bit of a general question, but I guess you can still help with that, right? So, what is the variorejuvenation, mitochondrial donation, pronuclear transfer, and IVIG treatment?
Yeah, very general question, but I will be happy to briefly explain everything. So, ovarian rejuvenation is a technique where once we are injecting platinum-rich plasma from the patient into her ovaries, and by injecting PRP plasma, we are making pre-antral follicles which are going to be ready for the FSH, accepting FSH and grown normally during 200 days. So they are getting faster. So they are recruiting faster. And this patient, if this is a patient in her advanced maternal age, she is responding with the nicely growing small antral follicles. And as soon as we may see her follicles, we are starting stimulation of such a patient. Usually, this is like a procedure which is dedicated for those patients who would like to have a last trial of having an opportunity producing their own eggs. After PRP injection, we usually see that FSH is going down, IMH is getting higher, and we may see a nicely growing small antral follicles. Mitochondrial donation and pronuclear transfer are alternatives for oocyte donation. In these procedures, we are using mitochondria from donor, and we use nucleus from the patient oocyte. And once exchanging nucleus and giving a potential of donor mitochondria to help this embryo to develop, the results are much better in terms of the blastulation and implantation and euploidy rate of the embryos, also for patients in their advanced maternal age. And this also gives an opportunity for patients to carry their own genes because genes are coming from the nucleus.
Perfect. Thank you so much, of course, again for that. But I just want to mention that we actually had webinars on that. So when we finish, you will be redirected to Dr. Liana's profile on the My IVF Answers, and you will be able to have a look at the previous webinars with Dr. Liana. And there you will be able to find even more details on those treatments, mitochondrial donation, for example, pronuclear transfer. So go ahead and check it out. And in the meantime, we did receive more questions. So let's have a look. What is the difference between NGS24 and normal biopsy?
Dear C, there is no difference. The biopsy, this is the mechanism which we do for the embryo in order to get a cell of the embryo to getting tested. And NGS24, this is the method how we are performing genetic testing of those cells coming through the biopsy from the embryo.
Excellent. Thank you so much for the confirmation once again here. And one more question. How do you identify each embryo that is created in your lab? Do they have a picture or anything like that before they are frozen that goes to the freezer with them?
Great question. Thank you so much. So for every biological material which comes into our laboratory, we have a marks and also the chips. And all straws and vials, if this is a sperm, they are labeled with the labels which are cryoprotective. They are not handwritten, they are printed. And this is a set of the labels which is printed for this patient. And the same label is used for the medical documentation, for the dish where we are going to do the nudation, for the dish where we're going to do ICSI, and for every straw, independently how many straws this patient has. And also we have a system monitoring the storage. So we have a big map of all storages which we have, and there are canes and vessels. And all these canes and vessels, including their colors and numbers, they are all in the system. So we know, and this comes from the machine with the artificial intelligence, and also is controlling this. And we know in which vial, in which straw is located. So, and also the process, how I mentioned that chip is read by the electronic witness procedure. So there is an embryologist who is reading a label, and this is a specific label for the specific patient. And there is also an electronic witness reader, which is reading also the same information from the system.
Right. Thank you again for interesting question. And there is a follow-up. Okay, so let me go straight to this one. So all embryos are numbered with the patient number.
In the straw, there is an information about patient name and patient-specific number, date of birth, date of the freezing of biological material, and type of the biological material which is frozen on this device.
Mm-hmm. And just to clarify, isn't there any specific number for each embryo?
No, there are just numbers of the straws, and these numbers are indicated in the system.
Mm-hmm. Perfect. Thank you for the clarification. I guess that it's now more clear. And as you can see, there's the things from the patient right here for you. Okay. And if you can have a look at this one, what is the oldest age for pronuclear transfer as well?
So far, the patient for whom we got blastocyst and embryo transfer was 47 years old.
Mm-hmm. Okay. That was the oldest patient that got this. Yeah. Okay. Thank you for the clarification. Okay, and what AMH is required for pronuclear and spindle transfer?
We would recommend for the patients who have at least 0.1. However, many of those patients, they have even less. However, the critical for us in order to proceed with the pronuclear transfer is number of oocytes received. And some patients, they are asking to combine oocytes from several treatments. For example, we got one oocyte from one treatment, another oocyte from another treatment, and then the third oocyte. And then only after that, we are starting the pronuclear transfer technique. So we also had patients with IMH lower than zero point 0.1. However, the more successful patient is in terms of her inclusion criteria, the easiest and more successful is the treatment itself.
Again, thank you so much for the question indeed, and of course for your help with that. Okay, how about ovarian rejuvenation at your own clinic? How much does it cost? Anything you can help?
Yes, we do it in our clinic, and this is quite, it's not, it's quite simple technique, I would call it. So patient needs to come 1 hour and a half before the planned procedure. We are drawing about 20 milliliters of her blood. We are performing centrifugation, and then just taking out the platent-rich plasma. After it is ready, we are doing the injection immediately. It's done under the anesthesia, and the patient has any negative feelings during this procedure, and she is staying over during 1 hour in the clinic, and then she may leave the clinic. Further recommendations are to check the level of FSH, IMH, and perform pelvic scans in order to check the efficiency of the procedure. The costs, please email me and I will dedicate you to our coordinators, and they will be happy to provide you information regarding the costs. But it's up to up I can be mistaken, but up to 1,000 euro per procedure, including the tests which needs to be done prior to it. But we need to double check.
Of course, that makes perfect sense. You can use the link. You can use the link, or you can get in touch with Dr. Liana with her email address. I have put this in the chat section. I will put it just in case in a few seconds as well. But in the meantime, let's have a look. There is another question about surrogacy. If someone would like to get some more details, they can contact you, or there's another email.
The same, so better not to mix you with different email addresses right now, so better to contact me, and again I will dedicate to the people. And we have a big international department. These are great people who are working for a long time with infertility, with different international patients. They are talking different languages, and they know absolutely great the process for each treatment, the timelines, the screenings needed, the documents needed, all the procedures, etc. And these are those team which are 24/7 together with our patients and taking great care for them.
Thank you so much indeed, of course. I have no doubt that you will be happy and able to help all the patients. And as you can see, again, there are some thank yous coming up your way. I believe we will be finishing. And once again, thank you so much, everyone, for all of your questions. And as Dr. Liana have said, you can just email her whether you want to find out more details on surrogacy, etc. And I'm sure she'll be able to help you out or forward this to her team, and they will be happy to help you for sure. Dr. Liana, as you know, it's always great to have you. You can see some details, some thank yous. Another interesting webinar, right, Angela? It's true. Another event with Dr. Liana, which has been amazing, and it's always the case. So I'm very happy to have you here. Great. Thank you very much. Thank you indeed. Dr. Liana, as always, is there anything you would like to add before we finish?
Yes, usually I'm just saying that please don't waste your time and make a decision fast in order you are thinking about being pregnant. So you need just to make a first step. But today's topic, it's about Ukraine. So I just would like to say that I'm proud that in Ukraine we have really wonderful IVF treatment, wonderful clinics, wonderful specialists, wonderful care. And I'm happy that you are interested in this topic. And definitely, Ukraine is a destination which will be the great destination for your treatment. You just need to select right clinic and right people to work with to be your team in order to get into your dream. And thank you so much for being with us and asking questions. And specifically for dear patient C, I will be happy to get in touch directly with you.
Thank you so much indeed. And I expect that you will get some emails, Dr. Liana, tonight. And if not tonight, tomorrow. So thank you so much. You know that
Okay.
it's always great to have you here. And I just want to mention that Dr. Liana will be back. Okay. There will be another webinar near the end of July. She will talk about totally different topic. And I'm already looking forward to it as always. And thank you so much for spending this evening once again, this Friday evening with us, and for all of your interesting questions. I do believe it has been very, very helpful. You never disappoint with the questions. There are definitely interesting ones. So thanks a lot. And of course, as you know, we will be back on Monday at 8 p.m. UK time. But also you will be able to find this webinar, but also all previous webinars with Dr. Liana and others on my IVF Answers. And when we finish, you will be redirected to the events with Dr. Liana, previous ones as well. And I do believe those will be helpful for you. So go take a look if you haven't seen them yet. And what can I say? As always, it's been a great session, Dr. Liana. Thank you so much, everyone. Thank you again. It's always great to be here with all of you. And till our next event, okay?
Yeah. Thanks, Carolina. Thanks, everybody. And take care. Goodbye.
Thank you. Good night, everyone. Have a lovely weekend. Bye.